Hi guys, this is going to be covering some first aid for y'all. I want to start out by thanking all of you for volunteering as coaches to teach our kids how to play baseball. Um, some little bit of information. We have milk crates by the concession stand that contain hand sanitizer, disinfectant, and they also contain your first aid kit for the field. Each milk crate is assigned to a field. So when you get those, please make sure you return them when you guys are done. We also have ice packs in the first aid kits, Band-Aids, sting wipes. You can get ice at the concession stand if you come up there and ask for a bag of ice. Just make sure with the ice packs and the ice, you don't put them directly on the skin. You make sure you've got a cloth in between the skin and the ice pack. In the concession stand, we also have liquid Benadryl in case a child is having a little bit of an allergic reaction. We also have children's chewable Tylenol and chewable Motrin in the event that they get injured and the parent would like to give them something for pain. We'll start out with allergic reactions. Some signs and symptoms of that is they complain of trouble breathing. You'll see some swelling in the face, neck, tongue, lips. They might complain that their chest feels a little tight or their throat feels a little tight. You may see some hives or itchiness. They may complain of also stomach cramps, nausea, dizziness. Next, we'll go into injuries. You can have some internal bleeding. Maybe the kid got hit by a bat, hopefully not. They may complain of some excessive thirst. Their skin will be cool and moist, but they'll look a little pale. Their consciousness, they might be a little confused. They may have a rapid but weak heartbeat. They may cough or vomit blood. If it's a limb that's been affected, it may be blue, pale, swollen. The skin may be a little rigid. In those instances, please call 911 and have them seen immediately. For open wounds, you have things like your abrasions, which is just more like a rug burn. Clean it with soap and water, and they should be fine. For cuts, they're a little bit deeper, bleeding. You want to take some gauze that's in the first aid kit and apply pressure to stop the bleeding with the gauze pad. Once the bleeding has stopped, go ahead and rinse the area to make sure it's clean, and then apply triple antibiotic and cover it with another gauze or a Band-Aid. If the wound is real deep and you can't control the bleeding, obviously you want to apply pressure and have someone take them to the emergency room to be seen right away. For muscle, bone, and joint injuries, you could have your sprains, strains, dislocations, and fractures. Obviously, if you see a bone sticking out of the skin, you're going to call an ambulance and take them to the emergency room. If the ligament is bent and awkwardly, you obviously want to also have them seen. If the kid reports that they heard a popping or snapping noise, I would encourage them to, or the parents to take them to be seen just to make sure they didn't tear something. Obviously, if they can't move their body part or they're complaining of whatever they injured, being cold, numb, anything like that, again, make sure that they get seen. If it's not something that is deemed an emergency, you can use the mnemonic RICE, which is we want to R for rest, limit their movement of that body part. We want to make sure we immobilize it with an elastic bandage or a splint. We want to use a cold pack or ice for the swelling. Make sure, again, put a dry cloth in between it. And do that for 20 minutes on, 20 minutes off. And then, of course, we want to elevate so that we can decrease the pain and the swelling. For brain injuries, that can obviously be caused by a blow to the head. It can lead to a concussion, bruising of the brain. So I'm going to go over concussions with you a little bit. It's a common traumatic brain injury, usually occurring in sports-related injuries. It can result from even just a minor bump, a blow, or a jolt, and it can be tricky to recognize. Many people who experience a concussion do not always lose consciousness, or they may only lose consciousness very briefly. Your best clue that a person may have a concussion are often their changes in behavior. So make sure you pay attention to that, because again, it can be just a small bump. If a person seems confused, dazed, stunned, they lose their ability to remember or follow a simple instruction that you know that they've been able to do previously, or they ask repeatedly what just happened. They may complain of a headache, feel a little nauseated, or even vomit. Their vision might be blurry, or they may even see double. They complain of some dizziness, or they're very sensitive to light or noise. Many people who have experienced concussions say that the concussion caused them to feel a little sluggish or groggy, or they just don't feel right. Signs and symptoms of a concussion usually are apparent after the injury, although it can appear hours or days later. So make sure if they got hit in the head, that we let the guardians know. For example, the person may be more sleepy. Children show changes in the way that they play or eat. So some signs and symptoms: thinking and remembering. They're going to have difficulty thinking clearly, difficulty remembering events that occurred just prior to the incident or just after. They may have difficulty remembering new information that you give them, difficulty concentrating. They may say they feel a little foggy, or just can't think. Difficulty processing information. Physically, they may complain of a headache, blurry vision, nausea or vomiting, dizziness, sensitivity to noise or light. They may have difficulty with some balance, and they may feel a little sluggish or have lack of energy. Emotionally, they may suddenly become a little more irritable, sad. Their emotions are heightened, or they get very nervous or anxious. And behaviorally, you may see changes in their sleeping. They may sleep more or less, and their changes in playing and eating habits. If you think, obviously, that anybody has sustained a concussion, please have them stop their activity and encourage them to be checked out by a healthcare provider as soon as possible, so they can be monitored and treated. And then we're going to go into some of your basic injuries. Nosebleeds. Have them pinch the nostril together while slightly leaning forward. They don't have to bend all the way forward, just slightly. And have them pinch for at least 5 minutes. Then you can check it and see if it's still bleeding. If it's still bleeding, pinch it for at least another 5 minutes. And again, if it's bleeding after that, they may need to go to the emergency room to have it looked at, because they may have damaged a vessel that needs to be cauterized. Mouth injuries. Hold the gauze, or have the child hold the gauze in the area where it's bleeding until the bleeding has stopped. If a tooth is involved, it has been knocked out, pick it up by the crown, not by the root that goes into the gums, and bring it to the concession stand. We will have coconut milk available that we can put the tooth in to preserve it until they can get to the emergency room and hopefully have it replaced. As far as environmental issues, we have heat illnesses. There's 3 types. We have the heat cramps, heat exhaustion, and heat stroke. For heat cramps, they're very painful muscle spasms that are caused because they haven't had enough to drink, or their electrolytes are down. So we want to move them to a cool place to rest. Have them sip a sports drink, and lightly stretch those muscles. You might want to massage them a little bit to help relieve the cramps. For heat exhaustion, which is your next step after they've surpassed heat cramps, we want to make this, you're going to see that the skin is cool, moist. It may be a little pale. They may start complaining of a headache, feeling nauseous, dizzy, and weak. Move them to a cool area with circulating air. So if we need to, sometimes we have a fan in the concession stand if we need to bring that outside so air is actually blowing on them. We want to remove as much clothing as we can. Apply cool, wet cloths to the skin. If they're able to swallow and drink anything, we definitely want to make sure we have them take sips of Gatorade or Powerade. We don't want them to drink it quickly, just want them to sip on it. If they can't drink fluids, or their level of consciousness has changed, or they start vomiting, we've got to call 911 and have them picked up and treated. If we've surpassed heat exhaustion, we're looking at heat stroke. This is the most severe and life-threatening. So I'm hoping that we've actually addressed it way before this. But they can become confused, have trouble seeing. They can go into seizures. Their skin will be hot to touch. They may be vomiting, breathing rapidly and shallow. Their heartbeat is going to be rapid and weak. We need to call 911 right away. And while we're waiting, put ice water, soak towels all over them, and keep replacing those towels until EMS arrives. For bee stings, you may have pain, itching, swelling, and redness. We have sting pads, like I said, in the first aid kits. You can wipe them over the area after you remove the stinger, hopefully with a plastic credit card, so we don't put any more venom into them. We want to cover it with a Band-Aid and apply ice to help reduce the pain and swelling. And again, we have the liquid Benadryl. We have the chewable Tylenol and chewable Motrin in the concession stand. For spider bites, we have two main spiders that are in this area. One is obviously the black widow, and that will cause immediate sharp pinprick pain that will dull where the area of the bite is. The muscle around it will become rigid, and you also see the muscles get rigid in the shoulders, chest, back, abdomen. The person will become restless, anxious, dizzy, have a headache, excessive sweating, weakness, drooping, and swelling of the eyelids are possible. Then we also have the brown recluse. If somebody's been bitten by that, you may not have pain right away. The pain can show up about an hour or more later. You'll see a blood-filled blister that forms in that area, and you'll see it looks like a target or a bullseye pattern. The blister will increase in size until it ruptures, and it will lead to tissue destruction, and you'll see a black scab. So clearly, if they get bitten by either of those, we definitely want to send them to the emergency room to be seen. If they get bitten by any harmless spider, we would just want to wash it with soap and water, apply some triple antibiotic ointment, and cover it with a Band-Aid, and then put a cold pack on it. The black widow or brown recluse, like I said, we'll wash it with soap and water, apply a cold pack, keep it elevated and still while we get the medical attention right away. Everything covered here will be typed out in the first aid kit, so I don't expect that you'll remember everything that I've just discussed. So again, that will be available to you as well. And the last thing I have to say is if a child gets injured and they need to go to the emergency room or to seek medical attention due to the injury, the coach is expected the day of to fill out a form that is located in the concession stand. Thank you guys. Bye.